Good morning. My name is Sukhveer and I am a student from Chronic Disease Management, Section KAA, and my student ID is 12724444230. And today I am going to present the Had to Do assessment video. Here is my 360 view of room. So she is my patient today. So hi, good morning. My name is Sukhveer and I am your nurse today. And doctor gave me the orders to do your Had to Do assessment. Is that okay for you?
Yes.
So can you tell me what's your name
Kour.
and your date of birth?
13 July
Can I see your ID man? Yeah. So it's completely matched with my data. So now I'm doing the hand hygiene and providing the privacy to my client. So now the first system is the neurological system that I wanted to assess. So first I will check her level of consciousness. So can you answer some questions?
Yes.
So where are you now?
I'm in the hospital.
And who I am to you?
My nurse.
And what's the day today?
Sunday.
So my client is totally oriented to the time, place and person. So her level of consciousness is appropriately correct. So now I will do the Parla assessment on her. So for that, firstly, I will do check her pupil reaction with the light. So you have to focus on the tip of my nose. Yes. So the pupil are equally round and equally symmetrical in the shape and round, and the size is 2 to 3 mm, and they are properly reactive to the light. So now I will check the eye accommodation with the help of my pencil. So for this you have to focus the tip of my pencil while I am moving the pencil. Don't move your head please, okay? Okay, when I take the pencil near to you, please let me know when you see the two. Okay, so the eye accommodation of my client is appropriate as her eye movements are okay with the direction of my pencil. So now I will, I'm done with my Parla examination, or now I will check her facial drooping, slurs, region, pronator drift. So first, can you smile for me and take your eyebrows up and squeeze your teeth. So as per her findings, there is no any facial drooping present on her face. So can you please repeat one sentence? The trees are green.
The trees are green.
So as per her answer, there is no any slurred speech present. So can you stand up for me, please? Take your arms up like that. Okay. Close your eyes and count 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
As per her body, there is no any tremors present, and her pronator drift is equally fine, equally correct, and there is no any imbalance in her body. So now I am done with the neurological assessment and do the documentation. So now I will do the respiration assessment, respiratory assessment to you. So now I will do the inspection first. So can you take the deep breath, please? Okay. Can you turn around? So deep breath. One more deep breath. So her breathing is non-labored, and the chest symmetrical walls are symmetrical from the interior and the posterior wall, and there is no any and her inspection and expection of the breathing is rhythmic. So now I will do the auscultation of her chest wall from the interior and the posterior wall. In the interior there is 10 landmarks, and in the posterior it's total 18 landmarks. For the interior, I will start from the right side of the sternum, from the clavicle bone. Deep breaths, please. Doing it continuously. Oh, for posterior, can you turn around, please? Thank you. Deep breaths continuously. So as per my auscultation, there is no any wheezing and crackle sound present on the chest, and the breathing sounds are rhythmic, and the breathing is 2 plus. So now I will do the documentation of this, and now I will do her cardiovascular assessment. In the cardiovascular assessment, there is total 5 valves present on the chest wall, and I will auscultate them one by one. So I will start from the first, that is a aortic valve, and that is present on the right side of the sternum on the second intercostal space, and the second one is pulmonic, that is present on the left side of the sternum on the second intercostal space, and the third one is the arch point, that is present on the third intercostal space, and the fourth one is tricuspid valve, that is present on the fourth intercostal space, and the fifth one is the mitral valve, that is present on the mid-clavicular line on the fifth intercostal space. And here I will check the apical pulse for 30 seconds. So her apical pulse is 86 beats per minute, and in my auscultation there is no any murmur sounds present, and proper lub-dub sounds are I heard, and there is S1 and S2 sounds are present. So I will do the documentation of that, and now I will do her abdominal examination. Can you lie down for me, please? So in abdominal examination, first I will do the inspection of her abdomen for the symmetry contour and the skin texture from the interior and the posterior side. So in my inspection, the symmetry of the abdomen is properly symmetrical, and the contour is flat, and there is no any lesions and scars and any skin deformity present on the skin of the abdomen. So now I will do the auscultation of the abdomen to check the bowel movements and bowel sounds. So there is total 4 quadrant of the stomach. So I will start from the lower right quadrant, auscultation, to the upper right quadrant, to the upper left quadrant, to the left lower quadrant. In my auscultation, the bowel sounds are present in the all 4 quadrants, and there is no any hyper and hyper bowel movements are present. So now I will do the light palpation on her stomach. So do you have any pain or tenderness on your stomach? Okay, so I will do the light palpation on your stomach. While you are feeling any pain or pain or anything, please let me know. Okay, so I will start my palpation from the lower right quadrant to the upper right quadrant, to the left upper quadrant, to the left lower quadrant. So in my palpation there is no any pain and edema and anything present on the abdomen. So I will do the documentation. So now I will do the integumentary and the lower and upper extremities. So in the first I will do the inspection of lower and upper extremities. So if you feel any pain or anything, please let me know. Okay, so in my inspection there is no any pain, deformity, any skin discoloration, any edema and lesions present on the upper and lower extremities. So now I will check the skin integrity and the bony prominence for the upper and the lower extremities, and the bony prominence for all the bones. And there is in the bony prominence there is no any ulcers, pressure ulcers present, and the skin is properly moist, and there is no any dehydration present because as skin is going back immediately. So now I will check the nails and the capillary refill time for the upper extremities and for the lower extremities, and there is no any bluish discoloration present on the nails are pinkish, and the capillary refill time is less than 3 seconds. So there is the nails are actually healthy. So now I will check her pulses. So first is the carotid pulse, that is present on the front of the neck and below to the jawline, jaw angle. So the pulse is bilateral symmetrical, and the rhythm is 2+. So now I will check the dorsalis appedia pulse, that is present on the dorsal part of the feet. This is also symmetrical, bilaterally symmetrical, and the rhythm is 2+. So now I will check posterior tibial pulse, that is present on the posterior part of the tibia. This is also bilateral symmetrical, and the rhythm is 2+. So now I will check the muscle strength of my client. Can you sit down for me, please? Okay, can you take your hands up, legs up? So can you push my hands towards you, towards me, towards you, towards me. The muscle strength is 5+, and her muscles are properly active. So I will do the document of my head to toe assessment, doing the hand hygiene and documentation. And here is the 360 view of my room. So this is my head to toe assessment video. Thank you.